This topic is administering oral medications. So let's first discuss what all the nurse needs to complete prior to administering the oral medication. The first step will be to review the medication administration record with the medication order. This medication administration record is also known as the MAR, or the MAR. The second step will be for the nurse to follow the 7 rights of medication administration. This is so the nurse can decrease any risk of error or administering the wrong medication to the wrong client. The most common medication errors occur when the 7 rights are not followed. The nurse will also need to check for any type of medication allergies as well as contraindications for the client to take an oral medication. These may include if the client is having difficulty swallowing or has aspiration while swallowing, if the client has a decreased level of consciousness, or if the client's gag reflex is not fully intact or impaired. As always, the nurse needs to implement proper hand hygiene prior to administering medications, as well as gather the appropriate supplies. Some facilities may use a computer-controlled medication dispensing system, and these are most commonly used whenever a controlled substance is being administered to the client. The nurse may also need to use the medication administration record, which we spoke to in the previous slide. The MAR will help the nurse be able to see the medication order and verify it. Some of the supplies the nurse will need to gather will be a medication cup or a syringe, based on the type of medication given. For any type of medication being administered, the nurse needs to grab a liquid for the client to take the medication with, for instance, a glass of water, and maybe a straw if needed. If the nurse is administering an oral medication that's in a pill or tablet form that needs to be crushed or split, the nurse may use a pill crushing device or a splitting device for scored medications. Lastly, the nurse should gather some paper towels and new clean gloves for the oral medication administration. Let's discuss the steps of administration for an oral medication. The first step and first priority is for the nurse to place the client in a safe position. The client should be in an upright and sitting position. The nurse will then unwrap the medication and place it in a medication cup if it's a tablet. If the medication is liquid, the client has the option to take it in a medication cup or an oral medication syringe. The nurse will then provide something to drink and watch the client take the medication. The nurse will then stay with the client and observe for any adverse effects, and then place the call light within reach and follow up in a timely manner. Now let's discuss types of solid oral medications. The first type of solid oral medication is a tablet. Tablets may be given in their original form, may be split or crushed. It's important to note that some tablets cannot be crushed, such as enteric-coated medications or time-release tablets. This is because it will alter their absorption. Some tablets may be scored to make it easier to split. The second type is a capsule. Some capsules may also be given in their original form, but they can also be opened and the contents can be sprinkled into food or drink. The last type is a chewable medication. It's important to note that chewable medications must be chewed completely before swallowing. Clients may need something to drink to ensure that they can swallow the entire contents of the chewable medication. Orally disintegrating tablets are another form of solid medications. As you can see in the image to the right, these medications need to be placed on the top of the tongue and dissolve completely prior to swallowing. Do not allow the client to chew this medication. Sublingual disintegrating tablets are another form of oral solid medications. Let's break down the word sublingual so we can truly understand how we need to administer these medications. Sub means under, and lingual refers to the tongue. So as you can see in the image to the right, these medications need to be placed under the tongue and dissolve completely prior to swallowing. Again, do not allow the client to chew this medication. Buccal tablets may also be administered, and as you can see in the image to the right, these need to be inserted in between the cheek and the gum area. These buccal tablets also need to dissolve completely prior to swallowing. It's important to note that the nurse needs to make sure the client does not eat or drink anything until 15 minutes after medication administration. This is to ensure that the medication has taken full effect prior to the client eating or drinking. Now let's discuss liquid medications in more detail. Some liquid medications are pre-packaged in pre-measured cups. If this is the case, the liquid medication may be administered out of that pre-packaged cup. If not, the nurse will be able to administer the prescribed dose of the liquid medication either in a medication cup or in a medication syringe. Now let's discuss the proper and safe way to administer oral medications to infants. As with any client we're administering an oral medication to, we need to ensure that the infant is in the correct position to receive and take the oral medication. As you can see in the image to the right, the nurse or caregiver needs to hold the infant in a semi-reclined position while also holding or restraining both of the arms closely to the caregiver or nurse. This will help ensure that the infant is not able to interfere with the medication administration. Next, the nurse will administer the oral medication via an oral medication syringe. The syringe needs to be placed towards the back of the cheek. Administer the medication in slow, small increments. This is to reduce the risk of aspiration or choking. Wait for the infant to swallow each small amount of medication prior to administering more medication. Never mix the medication with formula. We want to ensure that the infant is receiving all of the medication dose that's prescribed. It can be difficult to ensure that the infant has received all of the medication if it's mixed into formula or breast milk. For our older children, let's discuss how we can best administer oral medications. As we all know, most children may be resistant to medications. Allowing them to make some type of choice or have some type of autonomy in taking the medication can be extremely helpful. Allowing the child to decide whether they want to take the medication in a spoon or a cup, and allowing the child to decide which type of drink they'd like to take with their medication. This gives them a sense of control and therefore will allow them to be more compliant while giving oral medications. Some children may require an oral medication that is not produced in a liquid consistency. This may require the nurse to give a tablet in a crushed form. It's important for the nurse to crush the tablet and place it in a sweet food or in foods that are not essential to the client's diet. This will ensure that the child does not develop an aversion to their main food groups. As with our infants, it's important to administer the medications slowly. Although we have focused on oral syringes to give liquid medications to our infants, as you can see in the image to the right, this is an example of a medication spoon that has measured dosing on it, which can make it easier for the nurse to administer liquid medications to our older children.